question is like, can a rotten teeth be pulled at home? And I see you guys, you can see, you guys can see me smiling. It looks like or sounds like, you guys want to take me out of business. No, I'm just kidding, guys. My recommendation is this is not a DIY, do-it-yourself procedure that you want to do it at home. Can a tooth be pulled at home? Has any of my patients done that in the past? Well, when you have some severe gum disease, sometimes you can't just stop the tooth from just falling out. It just automatically comes out by itself. So in that case, if it automatically comes out, can you just take it out and then just bring it to the dentist to make sure that you have not done any serious damage to the teeth on the either side of this tooth or any other parts of your mouth? That is one thing. And the second thing is, if it is close to even coming off, and I have had several patients in my mouth, hey doc, this tooth has been loose for like almost 5 years or 5 days or 10 days or 10 months, and I'm just trying to pull this out. I can't, like it hurts like hell. So you don't want to be hurting like hell when the infection starts to spread. So as soon as you start to see a tooth becoming loose, and I immediately want you to go to the dentist or come and see us if you happen to be in the Dallas-Fortworth area at Implants and Gum Care, we will be able to help you. So to answer your question, can a tooth be pulled at home? And the answer is no. And my recommendation is, don't hurt yourself, and this is not a do-it-yourself procedure. You can do it at home. And also one other thing, and I just want to take the opportunity to mention that some people have all sort of dentists, like, and I'm sure you probably heard it in the news, and we live in the Dallas-Fort Worth area in Texas, and this has happened many times in the Dallas-Fort Worth area. They go to a dentist who practices at their apartment. So we have some overseas dentists who came from across the border, and they don't have a license to practice in Texas, but they are practicing in their apartment. And guess what? One of the patient went to the dentist who was practicing in their apartment. They broke the tooth, and now they don't have the proper tools to remove the broken tooth. Now the patient was sent to us by another friend to have the broken tooth removed. And I'm sure you guys probably heard this also in the news. You guys are familiar with the vampire facial. This was in the news a few months ago. There was a clinic in New Mexico. This was a spa and a facial aesthetic clinic. A patient went to this clinic within the U.S. in New Mexico. The patient, multiple patients, not just one patient. I want to say like it's almost like about 30 to 45 patients were diagnosed with HIV or infected with HIV when these patients went to that particular clinic. So you want to make sure that you're in good hands with a dentist at a proper facility. That way you can prevent any sort of problems like HIV or other infectious diseases. Again, if you're going to pull your tooth at home, and make sure that you're not using dirty instruments, because the last thing you want to do is save some money by pulling your tooth at home. Now you got some serious infection. Now you're going to spend thousands, and if not, like if you end up with the hospital, it may end up costing you millions of dollars to have the tooth or the infection resolved. So do not do it at home. Go to your dentist or come see us, and we'll be able to help you.